MRCGP SCA, the Simulated Consultation Assessment by the RCGP. What is this exam? This video is going to cover what do we know so far, what do you as a GP trainee need to know if you're going to be doing the new exam, essentially part 2 of MRCGP. I'm Dr. Aman Arora. I've been helping doctors pass the CSA exam for the last 10 or so years, moved into the RCA exam, which was the temporary replacement for this, and we'll be helping lots and lots of you pass the SCA exam in many years to come, I'm sure. This video is going to cover all the key things that you need to know. Let's go. So firstly, what exactly is the SCA? SCA stands for Simulated Consultation Assessment. It is the new part 2 of MRCGP that you as a GP trainee need to complete GP training. A brief background. For many years, we had MRCGP SCA, the Clinical Skills Assessment, where people would go to the RCGP building and do an exam. Took around 3 hours or half a day approximately, where you'd go from station to station to station and see 13 different role play based scenarios, and you were marked by assessors on your performance. That was the CSA. Then come March 2020, the CSA exam was replaced for the temporary RCA, Recorded Consultation Assessment, because of COVID, and people started recording their own real-life consultations, 13 of them, and sending them off for somebody to assess them at a different time in a different place. So recording your own patients in real life in your GP practice and being assessed on these. Obviously, ideally, this is not what people wanted, and therefore the new exam is due to come out later on in 2023, and it's kind of a hybrid between the CSA and the RCA. This is the SCA, the Simulated Consultation Assessment, and it's likely this is going to be the exam that you need to do if you're going to be an ST3 trainee in the foreseeable future. So what is the format of this new exam? Like we said, it's a hybrid between the CSA exam and the current RCA. So you are still seeing live consultations. You are still being assessed against live consultations, but they are by trained role players, as with the CSA exam, but you're doing them from a local practice, as with the RCA. So you can see why it's a bit of a match. So you're doing 12 back-to-back role play consultations, 12 minutes, 3 minutes reading time, 12 minutes, 3 minutes reading time. So it's still done all in one go, but you're doing it through an online platform where you'll be seeing a role player face-to-face on screen, or doing a consultation with a role player on a telephone and somebody who's marking you in real time. So you can see how it's like the CSA, where you're doing a circuit of cases. So it's similar in that aspect to the CSA, but it's also like the RCA in some aspects, because you're doing it in a local practice. You're not having to travel all the way to London, to the RCGP headquarters, to do it in their own environment. So just to quickly recap, 12 scenarios back to back, 12 minutes per scenario with 3 minutes of reading time before each one, and then you're assessed within that 12-minute period. So it's going to be quite an intense exam. You're going to be looking at your screen for a long period of time. We don't know too much about the platform that's going to be used yet, but I'm sure it's going to be tested and made sure everything is taken into account, including safety and making sure that everything is okay from an exam point of view. And then it's going to be released later on in 2023. So that's the format. We're going to be finding out much more over time, but if you're starting to think about preparing, start to get your mindset in that way. You're going to be doing quite a long exam. It could either be a whole morning or a whole afternoon. You're going to be doing it on screen, but it's going to be with role players. So it's going to be going through cases that have been pre-written, that are fictitious, with trained and calibrated and standardized role plays, which is very different to what people who are doing the RCA were doing, where you're seeing real life patients. So what is the SCA going to be assessing? Now, we haven't got full details on this just yet, but it's going to be similar aspects to what were assessed in the CSA exam and the RCA assessment, i.e. you're assessed around normal general practice consultations, normal general practice themes, and the kind of things that you'll be seeing as a GP to be in 3 or 4 or 5 months in the future. So this could be acute presentations, it could be chronic presentations, it could be social issues, it could be multi-issue presentations, it could be vague presentations, it could be patients with different communication challenges, it could be people who are embarrassed or angry. In essence, a variety of different types of situations that you may see as a day-to-day GP. Now, when we think back to the CSA exam of a couple of years ago, This was similar in that you had role players who you were seeing face to face, but again, the concepts of day-to-day general practice were the same types of things that you were preparing for probably back in CSA days. RCA was slightly different perhaps because you were seeing real life patients, so you couldn't almost say, I want this to be an angry patient case, or this is going to be an embarrassed patient case, or this is going to be a patient with these 3 conditions to see how you deal with them complexity-wise. As you know, in real life, you just don't know what's going to happen and you're kind of being assessed on whatever is presented in front of you. Whereas this, remember, is a fictitious, preset, organized exam, so you can almost start to prepare for different types of scenario that might come in front of you. On the RCGP website, it says that most of the patients that you'll be seeing, or most of the cases that you will get, are of patients, so a patient-doctor having a conversation. However, just like in the CSA exam in the past, you may have certain cases that come in with relatives or carers, or even other healthcare professionals that come to see you to discuss a particular patient, whether it's a district nurse or a social worker or something like that, or another member of your practice, again, in a fictitious way, but testing certain skills and concepts around general practice. And like with all of these things, the same things are going to be tested. Safety, communication, interpersonal skills, your ability to gather data, your ability to manage it both from a clinical and a non-clinical point of view, patient-centered care, reflective practice, holistic care. All of these buzzwords that we've been teaching for many years for both CSA and RCA are going to be needed for the SCA as well. And remember, for the previous 2 exams, both CSA and RCA, each case was tested around 3 key domains: data gathering, interpersonal skills, and management. Now, we haven't been told exactly what the marking scheme will be for the new exam, but it's likely to feature things that are similar to those concepts, because let's face it, that is what general practice is all about. How do you gather information? How do you gather data through questions and examinations to build up a list of issues? How do you then manage that situation going forward, both clinically and non-clinically, in a patient-centered way? And how are you dealing with that patient from an interpersonal skills point of view? So it's not rocket science in terms of what you're going to be coming across in terms of SCA, but we're just waiting for that specific official guidance in terms of the marking scheme. Let's talk timelines then. So we don't know exactly when the first SCA exam is going to be held. Currently, there have been pilot exams being done. There's feedback on the RCGP website that shows that people seem to like the new format, but the exact date should be released hopefully in the next couple of months. There is an RCA assessment, of course, happening in March and April, and there will be another RCA assessment in autumn of 2023, only for those people who haven't passed RCA in this academic year, but everybody essentially from April onwards is going to be doing the new assessment. We just haven't got the dates yet, but usually, if you think back to CSA exam days, the first CSAs for each academic year usually started around October time. So I presume September, October is when the new exam is going to come out. However, at this point, because it is still going through the GMC process of being approved, quality assurance, and the usual things that happen for postgraduate exams, we haven't got those fixed dates just yet. So how can you start preparing for the SCA? I get asked this question a lot by trainees who have just passed AKT, who are now starting to think about this next assessment that's coming up in ST3. The first thing that I always get asked is, what about our RCA resources? There are lots of you out there who have currently got our RCA resources, whether it's our RCA Gold package, RCA video courses, audiobooks, etc. And they're asking, what happens when the new exam comes? The first thing to say is, if you have any of our RCA products at this point, they will automatically change to the equivalent SCA format when we get more details about the exam. So what I don't want you to do is think, well, I can't really use this stuff now, or I'd rather wait to buy things or use courses or use resources when the new exam comes out, because let's face it, a lot of the things that are going to be assessed in a GP consultation type assessment are going to be the same. So I don't want you to worry if you've either got our RCA Gold package, for example, right now. It doesn't mean that you need to stop using that because the exam is different. Keep on using that. Go through the videos, go through the audios, go through the flashcards, because they are building up your knowledge and your kind of sense of how to think about things from a GP ST3 consultation based approach. So if you have our RCA stuff, don't worry, that will all convert to SCA resources once we get more information. And if you're thinking about using something now but don't want to purchase it because you're thinking, well, I don't know about the new exam, don't worry. There are lots of other trainees who have just purchased the RCA Gold package, for example, and you can do the same and use those resources both to get you ready for ST3 in general, to get those primary care concepts going through your mind, but also, of course, for your exam as it gets closer to the time. How can you find out more about developments of the SCA? Of course, as time goes on, you are going to get more and more updates from the RCGP. So of course, keep an eye out on the RCGP's SCA webpage, because they're going to give you some details there as they emerge. Secondly, we have a blog. There'll be a link somewhere down here to our SCA blog. We will keep updating that as we get updated information about dates, marking schemes, etc. And thirdly, keep an eye out on the YouTube channel and subscribe, because every time we get an update, we'll be putting out a video to cover it step by step, so you don't need to worry about this fast changing new exam that's coming your way. So how can you start preparing now? The first thing is start to get into that primary care mindset. Even though we don't know exactly what's going to come your way, you can tell there are certain things that you need to start upskilling yourself on. And you've already been doing this in ST1 and ST2 when you've done your primary care role. So for example, making sure you're getting used to primary care NICE CKS guidelines, making sure you're going through red flag questions for when someone comes in with back pain or depression or a headache, for example. So you're starting to understand those key clinical questions, thinking about how do I bring in the other aspects of a primary care consultation, the ICE, for example, the patient's mind, psychosocial, thinking about links between life and medicine and life. Again, we talk about these on all of our YouTube videos and all of our RCA courses, so make sure you start to get into the mindset of primary care consultations, because those are the skills that are going to be looked at when it comes to an exam like the SCA. Try to start thinking of what potential types of case may arise and how you might think about tackling them, whether it's a patient with a particular complaint, whether it's a patient who you're breaking bad news to, whether it's a patient who's a little bit angry, a little bit embarrassed. Think about situations, telephone consults, how do they differ? Third-party consultations, how do they differ? Think about general specific conditions that might come in, non-specific abdominal pain, non-specific chest pain, non-specific headaches. Again, getting used to thinking about these things early so that when you come to proper exam preparation, you've already gone through these concepts in your mind. Again, our courses, videos, audios, they all cover these types of things. So if you wanted to get ahead, then have a look at the RCA Gold package, which, like I said, will change to an SCA Gold package as time goes on. So I hope that's been of some value. In summary, the SCA, the Simulated Consultation Assessment, is the new Part 2 MRCGP exam that's coming in late 2023. It's replacing the current RCA. It's going to be an exam that you do in one sitting, so all consultations together, 12 consultations back to back. Each consultation lasts 12 minutes. There's 3 minutes reading time between each consultation. You'll be on a role player video call or an audio call with an assessor watching or listening and marking you at the same time, and you'll be assessed on core general practice competencies. We don't know when the first date is coming out. It'll be later in 2023. Stay tuned to the channel, subscribe, and follow us, of course, on Instagram and Facebook and Twitter, where we'll be putting out updates as they arise. I hope this has been of some value. If you are looking to get some of our RCA or our SCA resources, then don't forget to use the coupon AuroraVideo10 for 10% off anything on the website. And like we said, if you currently have the RCA Gold Pack or the RCA video course or the audiobook or the flashcards or anything else that we do for RCA, don't worry. If you're within subscription, they will change automatically to SCA as 2023 progresses. I really hope this video has been of some value. If you are preparing for the RCA or it is coming at some point in the future, please do not worry. In fact, I shouldn't say please don't worry. It's natural to worry, but remember, everybody will be anxious about a new exam. It happens every time a new exam comes out. Secondly, it's not going to be too different to other Part 2 MRCGP exams in terms of the types of things that you will be assessed against. And thirdly, remember, it is real life general practice. So the more practice you get in that aspect, the better prepared you're going to feel for the SCA. I really hope this has been of some use. You know the hashtag #CanPassWillPass, hashtag I went with Aurora. Have a super day.